Hello, my name is Matthew Hendricks. I am a student here at Anderson University completing a change project. The subject of my change project is infection rates within the operating room. The title of my change project will be Decreasing Infection Rates by Lowering the Amount of Traffic in the Operating Room During Surgery. The problem statement for this is surgical site infections create one of the biggest risks to safe and cost-effective healthcare. They can cost the hospital lots of money and create poor patient outcomes. Surgical site infections have a huge impact on rates of death and injury related to surgery. Infections can increase the length of stay and overall cost of hospitalization. The purpose statement. The purpose is reducing OR traffic and to allow ventilation systems that control airborne contaminants to work properly. Operating rooms are specifically designed to reduce airborne contaminants through its own ventilation system. This system will not work properly if the door to the operating room is opened frequently. The problem here is during an operating room case, during a surgery, many items are needed for the case. We must be prepared to have those items within the room so that once incision is made, we don't have to go in and out of the operating room. Kurt Lewin's model of unfreeze, change, and refreeze can be applied to this change project. Unfreezing is the first stage. It incorporates getting ready for change. This stage includes a change specialist, for instance, a nurse manager. In this stage, infection rates will be observed over a sample period of time or a set number of total joint replacement surgeries. Before any changes, the amount of bacteria in the operating room will be measured. Potential barriers to change, like staff behavior, will be assessed. Staff behavior being, we know that we must keep the door closed. It decreases infection to do so, but staff behavior goes back to doing the same old thing, going in and out of the room as we please. The second stage of Lewin's change theory includes taking a look at change as a strategy rather than a one-time event. Training and monitoring are at the forefront of this stage. Staff should be instructed on the outcomes of opening the operating room entryway. This information can be taught early in the orientation process, but should be emphasized often to gain the best results. The nurse circulating the operating room during a case will observe the number of times the entryway is opened amid a surgery, and outcomes will be recorded and assessed. Refreezing, or the third stage of the theory, promotes balancing the change within the goal that it sets to be directly infused into existing frameworks, for example, practice and policy. In refreezing the change, the nurse manager considers the change, considers the ways to emphasize the main challenges to the change. In this refreeze stage of the model, the change will be reinforced, infection rates will be reevaluated, and bacteria levels in the operating room will be remeasured. The methods that we will use during this change project are to examine the infection rates, to measure the amount of bacteria, to make changes to policies, set goals for decreased number of infections, provide education to staff, examine potential barriers to the change, such as staff behavior, like we've mentioned before, implement punitive actions if policies are not followed, offer incentives when infection goals or policies are met. After the change has been made, re-examine the infection rates or amount of bacteria within the operating room. The outcomes that we hope to see are to a decrease in bacteria and a decrease in infection rates found in the operating room, a decrease in complications for patients post-operatively, and increased reimbursement from insurance and Medicare. There will also be, as a byproduct of all this change, an increase in teamwork and communication by the OR staff. It'll be a safer environment for surgery, better patient outcomes overall. Patients will be able to regain mobility regain mobility sooner post-operatively. An increase in the OR's adherence to policies. These changes can be made. These changes should be made. That will help to decrease infection rates within the operating room. This is my change project. I hope you've enjoyed it.